Hello, I'm Kay Brown. Welcome to VETtalk TV. It's an online show for pet lovers and also for veterinarians. Now, I'm not a vet by any shape, but the lady beside me, the lovely lady, Dr. Sarah Goldsmid from the Animal Referral Hospital, certainly is. Thank you for letting us come with our cameras behind the scenes where no one else usually gets to go.
Well, it's great to have you come and join us. It's fantastic to have other people share in all the things that we do at the Animal Referral Hospital. As you can see, we've got a crazy, busy specialist and emergency hospital here, and it's great to have you come and experience some of what we do here.
Well, it won't be like some of the formularised reality TV shows, but it will have successful stories.
I'm not running in a bikini on Bondi Beach, no. Can I say that?
Yeah, you can. We're actually going to have two channels on VETtalk TV online. One for pet owners who might be a bit squeamish, and the other one for perhaps vet students or people who do like to see how these procedures are carried out.
Absolutely. There's a lot of very unusual things that we do here that people probably have never seen before. Even veterinarians probably haven't seen. So it's very interesting cases. I think that everyone will enjoy something out of it.
Excellent. Thank you. So without any further mucking about, let's start watching. Like humans, pets also suffer from allergies, but instead of sneezing, they scratch and scratch, sometimes until they bleed. Why? Veterinary dermatologist Dr. Dani Hoolahan from Sydney's Animal Referral Hospital explains.
Yeah, so in spring and summer we tend to see a flare-up of what we call atopic dermatitis or environmental allergies. So that's allergies to pollens, moulds and dust mites. And that can be a year-round allergy, but typically the dogs that are sensitive to pollens are going to flare up in spring and summer. And so when they flare up, they tend to get extremely itchy, which can be uncomfortable for both the dog and the owner.
Say good day to Twitch, a 3-year-old boxer cross who suffered environmental and food allergies so severely that her owner, Kate Dawes, seriously considered putting her down to end the pain and suffering.
She had rash on her belly, a very red, angry rash. She was running around the house, scratching herself on furniture, the carpet, the walls, anything she could scratch on.
Got an itchy pet? Kate Dawes has some good advice.
Get them straight to the vet.
And while every dog or cat is different, there are some great, innovative treatment options available.
To find out more about atopic dermatitis with Dr. Dani, just log in or register now. Next on VETtalk TV, dealing with smelly cat wee.
So now we come to the crux of cat medicine, which is urine.
Absolutely. How do we deal with cat urine? Dr. Kim Kendall has been asked this question many, many times, as have I, but now, hopefully, we'll get some answers.
Cat urine's actually sterile. I mean, I've got some old cats who have very infected urine, but in general, cat urine's sterile. And the problem with disinfectants is that they have a component that smells like cat wee. I mean, ammonia is a portion of it. So when you use ammonia or some of the other disinfectants, now you've made that little patch of cat wee that your cat has done smell like a tiger has come and peed.
Uh-oh.
Well, if you're a cat, what are you going to do? You're going to pee over the top. You can't be tolerating a tiger on your carpet. And that's the other problem for cats, is that freshly laid carpet, the solvents in the glue smell like tiger wee. So does fresh paint. It's pretty sticky and it's pretty icky. And I think even the cats don't particularly like to have stale urine smell around. So vinegar and baking soda and all those other, but no, when they do actually rigorous tests, it doesn't work. So the big message actually should be, if your cat has peed outside the litter tray, consider it a distress signal and get onto it, because if you do that within a month, 100% of cats can be redirected back to their litter tray.
Log in now to check out Dr. Kim's practical solutions for dealing with cat wee. You buckle up your kids, but what about your dogs? Recent research data from NRMA Insurance showed an incredible 50% of pet owners don't restrain their dogs in the car. Alarmingly, even if they do, just 2 out of 25 harnesses tested pass the gruelling NRMA insurance tests. For the full story and recommendations, just log in or register now. It's totally free. Sandra, many pet owners whose pets are being diagnosed with cancer are often reluctant to pursue treatments such as chemotherapy. Why is that, do you think?
Yeah, so to start with, most of my patients already have the diagnosis before they see me. So to a certain degree, they've already been desensitised to that emotional sudden impact of the word cancer. I tend to use the word cancer rather than tumour, mass, growth, because I find that very misleading and confusing to some owners. And I've certainly had owners come to me and see me, and they're shocked when I say the word cancer because their vet has only ever used the word tumour. So they didn't realise that they were the same thing, which is obvious to us, but not necessarily to an owner. I would say 90% of dogs and cats that undergo chemotherapy sail through and feel really well, but a percentage of them do get sick. A majority of those can be handled with anti-nausea medications and antibiotics, and some end up in hospital, but by far the majority of our patients feel well while they're on therapy. So for me, treating cancer is like treating another chronic disease. So if your dog gets diagnosed with heart disease, we put your dog on some drugs to help its heartbeat. If your dog gets diagnosed with diabetes, we start administering insulin twice a day. So if your dog's diagnosed with cancer, we give your dog some drugs to help them with the cancer, and to keep that cancer burden at such a level that your dog can still have a good quality of life.
Dr. Sandra Nguyen, thank you very much.
Thank you so much, Brian.
Next on VETtalk TV, ARH Exotics vet Dr. Jayne Weller comes to the rescue of a much-loved pet, a children's python.
So this snake actually burnt itself on a heat lamp about 2 weeks ago. And I originally saw it, and the skin was quite badly burnt. We put it on antibiotics and some topical ointment. But then when it sloughed, so that means when all the skin came off in its normal shed, the scab or the eschar over the burn area actually came off with the skin, and so we ended up with open wounds, as you can see here. So today we're going to attempt a surgery where we're going to close this area, this smaller wound, and then this larger wound, we're actually going to take a little piece of skin from the back half of the body and place it on as a skin graft. And we're going to use just one graft for the time being, just to test it out. And if that takes, then we'll probably do another couple of grafts in the same area. So I'm just going to weigh her, so we've got a good weight for anaesthesia. This is a children's python, and she is in very good condition other than her wounds. So it's a bit of a shame that this has happened to her. So we'll just leave her in her box for a little while we set up for surgery.
Well, I think, would she be in any pain?
She is in quite a bit of pain, so she's had pain relief also, and that's by injection, and snakes actually metabolise things a lot slower, so she only gets injections every second day for the pain relief, and for her antibiotics it's every third day.
To see the entire story, including the actual operation, just log in or register below. Meantime, if you love horses, you'll love our featured product.
It started out with dogs, wild dogs, now wild horses. Give us a little bit of background, first of all, before you tell us how the product actually works.
Yeah, well, actually, we started in horses. So dogs are brand new for us in the dog world, but we did start in horses. And it started years ago when I was rugging one of my horses, and there were so many insects that I couldn't do it quick enough to get inside and get away from the insects. And then I stopped and thought, well, I've just left my horse out there, unable to defend himself, and they harbour underneath normal rugs, so I've given them harbour, and there has to be a better way. There has to be a way that I can protect, them from insects, and that started the whole ball rolling.
Fantastic. So what's in it? I mean, do the insects actually die, or they just don't like it?
What we've got is a patented process that binds permethrin into the fabric. Permethrin's effective against approximately 80% of insects, and it's about the binding agent. If you spray a rug with just permethrin, it doesn't last. It's water soluble, and it quickly dissipates and can give a massive overdose to the horses and our streams. So what's happened with this is the way it's bound in the fabric that the EPA approve us for 25 detergent washes or 6 months full-time weathering. At 100 detergent washes, we've got up to 91.7% still in the fabric.
So is it a use in summertime only kind of thing? I guess the silly question, because that's when the insects are around, right?
Yeah, so it's generally a summertime product. It depends on Australia. We sell actually through Queensland, Northern Territory all year round. In WA we sell a lot too, yeah. So, and of course the further south we go, the less demand that we have, but we do sell quite a lot of rugs and products into Victoria, New South Wales, South Australia.
You've got different styles here. Are they just literally different styles, or are they different strengths?
Yeah, no, they're all exactly the same strength. But what happens is we've been able to put that technology into all of our different. We've adapted to horses and what our customers need. So, and we put a lot of work into our designs as well, which is really important. We cut forward withers, so to prevent edemas, we've worked with saddle fitters on where the best part where to not put pressure on a horse. We've created some really good pressure releases. So we've got a lycra pressure release which releases all the way down the mane and also offers protection to the wither area, too much stress with the horse bending down all the time. So it's just an extra with the cross chest, better designs, rugs that don't move on your horse. So we are famous for design, and we only design from the horse's perspective, not really for the owner. We only do black for eyes so we don't harm eyesights and things like that.
Could it actually be used on cattle, for instance?
Cattle, that's interesting, because we have had a request for cattle, but we do need to have the numbers with production in our factories. We do need to have the numbers. So we haven't got to cattle yet. So we've done the dogs and horses successfully, and they've both been fantastic, and they've both gone off. Cattle's on my list, along with clothing actually. My third company will be Wild Clothing Australia. So we've had that approved for use with children. So we'll be moving forward with that soon.
Well, just remember us when you're famous, really famous.
I will. Thank you, I will. Thanks, Brian.
Next time on VETtalk TV Online, right, Sally's incredible bladder stones.
I had a packet of 2 Obison, please. Just filling it up. Thank you. So that's our bladder. It's full of stones. Can you see that it's holding its shape? Not because of weed. Could I have another sterile kitty dish like this? It's going to be a lot of stones. So how should we close this bladder?